Hi, my name's Jesslyn. I'm going to be a student nurse today, and I'm going to be inserting and removing an NG tube. I'm going to start by making sure I have the correct supplies. I have a syringe here. I also have my NG tube, my pH test strips, and I also have tape and my gloves. I then will prepare the tube by getting it out of the package. I will make sure there's no damage to the tube. I'm going to raise my patient into a high Fowler's position, placing a pillow behind their shoulders and their head. I'm going to raise the bed to a working position for myself, and I also will measure the length of the tube, starting from the tip of the nose to the earlobe, and from the earlobe to the xiphoid process, taking a piece of tape and measuring where the xiphoid process left off. I will then be on the right side of the bed, since I am right-handed, and if I was left-handed, I'd be on the left-hand side. I will take a linen saver pad and drape it across my patient's chest. I will hand them an emesis basin and some tissues if it's needed. I will arrange a patient signal with them in case they need to communicate to stop at any time of the procedure. I'm going to do some hand washing. I then will put on my clean gloves. I then will wrap 10 to 15 centimeters of the tube around my index fingers, and then I will release it. I will lubricate with water-soluble lubricant 10 centimeters of the tube, and then I will hand the patient a glass of water with a straw in it and instruct them to hold their head up and back against the pillow before I insert the tube. I will begin to insert the tube. It will be at a curved downward point, and it will be against the floor of the nasal passage on the lateral side, aiming towards the ear. I will then tell the patient that they may feel slight resistance, so I'm going to push gently and continue pushing and advancing on. The patient's eyes may tear up, so I may give them a tissue. I then would continue to insert past the nasal pharynx by gently rotating past the opposite nares. I'm going to pause for a moment to allow the patient to relax, explain the next step, that they will need to start to swallow the water I gave them earlier. I'm going to ask them to move their head towards their chest. They're going to take small sips of water and swallow. I'm going to start rotating the tube 180 degrees. I then will direct them to sip water, and as they're doing that, I will slowly advance the tube, and I'll advance it 5 to 10 centimeters within each swallow. I will continue to advance the tube to the desired distance that I had taped off, and I will temporarily secure it with tape. I then could take my syringe here, and I could draw up some of the gastric acid, testing it with my pH strip here, making sure that it's at the correct spot before any feedings or anything were to occur. And then my final check I would do is ask the patient just to talk to me to make sure that it's in the right spot. And after confirmation, I can clamp off the bottom of the tube, or I can connect it to other necessary equipment like suctioning. After that, I will secure the NG tube with either a fixation device, or I'll just use my tape here. And then I will fasten the tube to the patient's gown using a rubber band and like a slip knot type of ordeal. And I will leave the head of the bed at a 30 degrees, placing them in the smallest working condition, making sure that they have their call light in place. I will remove my gloves and perform hand hygiene. And then when I am removing the tube, I will check the health record for removal verification. I'll make sure to stop the tube feedings 30 minutes prior to removing. I can assist the patient to a sitting or high Fowler's position again, making sure my bed's back into working position for myself, and I will place them with the emesis basin and reach and give them tissues if needed. I instruct them that there may be some gagging, but it will be briefly. I will drape the linen saver pad back across their chest. I will do hand hygiene again, place some clean gloves on. I'll make sure his suction is turned off if it was used. Again, if I'm right-handed, I'll be on the right side of the bed. If I'm left-handed, I'll be on the left-hand side. I'm going to attach the syringe to the proximal end of the tube, and I'm going to flush 10 milliliters of air into it before removing. I will unpin the tube from the patient's gown. I will also untape it from their nose, and I will clamp the end of the tube. I'm going to hold gauze to their nose, and I also will have a towel in my opposite hand ready in case I need it to grab the tube. I'm going to ask the patient to take deep breaths and hold it. I then will withdraw the tube steadily, quickly, and smoothly. I'm going to place a biohazard container in my reach. That way when I pull the tube out, it will go in there. I will clean the patient's nares after withdrawal with the towel, and I will dispose of the biohazard bag in a biohazard container, placing the patient in the lowest position, in a comfortable position, and with their call white and reach, I then will perform hand hygiene. And that's how you insert and remove an NG tube. Thank you.